7 FHIR standards and EHR integrations. I believe all of you who are joining the session today, you guys are aware of HL7 FHIR, and obviously you guys know what EHR is, but still we'll have a little bit of a brief background about the technologies. Then we will dive deeper into what the current healthcare industry looks like and how HL7 and FHIR is being widely utilized. So this is the agenda for today. As I mentioned, we have the current healthcare IT landscape, the modernization, roles of HL7 FHIR, EHR integration, what are the modernization strategies, what are the best practices, and we have a couple of real world case studies in the middle. Some of those case studies which I personally worked on and how those looks like on a EHR level as well as a standard level. Then we have what is the look ahead for the future of interoperability. As I mentioned, please feel free to drop your queries. I'll be taking the queries after the presentation, and I'll be more than happy to address any queries that you guys have. So moving forward, where healthcare IT stands today. Before that, let me give you a little bit of a background about HL7 FHIR and what it stands for. So HL7, as you guys are aware, the full form of HL7 is Health Level 7, and FHIR is essentially fast healthcare interoperability. So essentially, just to give you a little bit of a history lesson, HL7 actually came about in the 1990s, and there have been various versions of it until 2014 when FHIR came around and both of those were merged. So essentially what it allows us to do in very simple terms is it allows us to connect different systems in the healthcare scenario. For example, there is a hospital and they have lab orders which they want to generate, or there is a hospital that integrates remote patient monitoring in their capabilities, and they see patients via remotely. It can be a chronic care disease related patient, or it can be any patient that you want to see the vitals for, which are essential for your clinical overview. So HL7 FHIR standards allow us to connect both of these different devices or different systems, and it allows us to build a bridge between different healthcare operation devices or healthcare operations systems, and allows us to communicate between each other. So I'll give you a couple of examples as we move forward, but let's see where the healthcare IT industry stands now. So the healthcare technology in 2024 is expected to grow 15% year on year, and obviously COVID gave it a boost, and right now everybody, even third world countries, are adopting healthcare technology, and obviously in the States it has been widely adopted since 2008 after Obamacare came in. So even though the market is growing, 60% of hospitals still use legacy systems. There are different reasons for it. One is obviously the comfortability. They have been using a system for a long time and they get comfortable with it and all the scenarios it provides. But as the industry evolves, they have to switch to a more modern system. And then the patients, obviously they want easy digital access to their health data, but many healthcare systems still don't provide it, and they have to call the hospital or they have to call the practice and get those data. So we will see how do we alleviate these gaps and how do we remove these gaps and make sure that all the healthcare IT industry moves to a more modern digital overview. So before we dive into that, let's see what are the challenges of using outdated HL7 and EHR. So keeping an old system means dealing with old systems that use up to 30% of an organization's IT budget. Right now, since like any industry, since health IT has been evolving, the costs have come down significantly also, and it is hard to move patient data between departments, or when you're moving patient data from an older EHR to a modern EHR, sometimes that makes it a little bit more difficult to adopt a new system. The legacy systems usually don't meet the latest regulations, compliance standards, and they obviously don't have the requisite certification which are required in today's modern world. And as per a latest clinical survey, only 1 out of 3 patients are happy with their ability to access their health information digitally. As I mentioned, sometimes they have to call the clinics, call the practices to get their latest data, get their latest lab results and all of that. So, and without integration, obviously the most people who are affected are the staff. They have to enter the same data. It becomes very mundane and it becomes a rigorous job as we move forward. Now, how HL7 standards are powering healthcare interoperability. So healthcare systems, as you know, use different platforms, EHRs, labs, pharmacies, imaging, billing, and without a common language, they cannot communicate smoothly. As I mentioned in the beginning of our presentation today, HL7 FHIR provides that common bridge or common language that allows different systems to communicate seamlessly and provide the same information across different varieties. So we have some HL7. What are the different versions? There have been 5 versions of HL7. So we have the most popular one is obviously HL7 version 2. I will show you an example of how a HL7 message looks like. Obviously I cannot show you the whole script, but I'll show you an example in the next upcoming slides on how a HL7 message looks like and how it communicates between different systems. Then FHIR, obviously it provides modern APIs for faster patient-centered data sharing. Then we have CDA and CRUD, which allows a structured component of data to be moved between different systems. Now, we will talk about how HL7 helps in real-life data exchange. So I have a deck to show you a lab order system connected to an EMR and how it uses HL7 FHIR capabilities to make sure that the patient data or the lab order is moved to the lab, and how we get the result back from the lab using HL7 FHIR standards. So as I was saying to you, how a HL7 version looks like, this is a sample. So this is essentially how the scripting looks like in the backend, and this is standard across all the HL7 version messages. So if you are talking between a EMR and a lab, this is how that would look like, and if you are talking between an EMR and a wearable device, that is how it would look like. So here you can see you have the MD details, you have the PO box. Obviously you'll not be able to understand it because it looks like gibberish, but this is how the backend looks like, and this is how the HL7 experts and FHIR experts code in the backend. Now, as I was talking to you about, now we will walk through how a lab order is sent to a lab using EMR and HL7 FHIR standards in the backend, and how do we get the result back from the system. So there is no calling in between, there is nothing of that sorts. Everything happens digitally using interoperability. So here what you're seeing on my screen is a custom EMR that is developed by CapMinds, which is my organization, and here you can see how the procedure order looks like. So here you can see that for this particular test patient, we are going to order a primary diagnosis, we are going to order the test for oral fluid toxicology, and you can see the sample clinic added here, and you can see the embedded what we need from that procedure test. So once these procedures are added, it appears something like this, and then once we get the results back from the lab, it's as simple as that. Once you order, the lab receives it, and once the lab tests are done, you get the results directly in your EMR system. What allows us to do that is obviously the interoperability that we connected with the lab for. Then we have the result view. Once we get the lab results from the sample lab here, this is how the result would look like. So here you can see what the toxicology reports look like, and here you can see all of their details in this. So you don't have to get a PDF from the lab in an email or any unsecure exchange. It comes directly to your EMR system. This is what the lab report, which was generated by the lab, looks like. Then these are all the details of that particular lab report, and this is how it looks in your EMR system. Now moving forward, this is the actual report. If you want, you saw that in our lab order screen we ordered for a PDF. This is how the lab report PDF looks like once it's generated by the lab here. Then once these results are here, obviously these needs to be approved to be added into the patient chart. Once we click on sign results, which is done by the provider, it automatically gets added into the patient chart, which I'll show you in a second. So this is how it appears in the patient chart. So this is one of the examples. This is one of the most commonly used interoperability examples. And obviously, if you reach out to CapMinds, we can help set up any system that you have. It doesn't have to be an open EMR or custom EMR developed by us. It can be Epic, Cerner, NextGen, Meditech. HL7 FHIR standards are same. So we can do the interoperability for you, and you guys can move to a more digital world. Then these are some other sample outputs which I want to show you. Now, as I was talking, why the EHR integration matters, these are some general points, but from a overview, as we are moving to a more digital world and there are a lot more different EHRs for different specialities, for different use cases. So as we add more specialities, add more specifications, there are a lot of companies that come up with a new EHR system, and you can like that, but those EHR systems are not connected to all the systems that you want. For example, you want to order a oncology order, or if you want to order a ophthalmology, you want to do a surgery, all of these systems need to be interconnected. That's why your EHR needs to be integrated with all the systems that you use. It reduces your manual time. You don't have to check it again and again. It comes to your EMR system, and most EHRs right now, what they do is they have a API connectivity, or they have a FHIR server connectivity, so it's very seamless to integrate it now. Now moving forward, so what happens, some of our case studies, what we did was how HL7 and EHR, when they work together, how it brings down your cost, how it brings down your manual labor that we do. So most HIEs exchange HL7 version 2 messages, and 90 to 96% of labs and pharmacy data work with that. And TEFCA is also scaling nationwide, so there are about 9,800 plus organizations who have signed up for this, and they are moving to a more interoperable world. And interoperable EHRs reduce data entry mistakes and improve safety. So obviously another important component which I forgot to talk about is when you move to a secure interoperable environment, there is no PHI leakage. So we can make sure that the sensitive patient data that we have is secure across all the devices that we have, all the EMRs and EHRs that we work with. Then we have a couple of strategies for you, even though you can reach out to CapMinds and we can support you with this, but even if you just want general strategies on how you want to modernize your healthcare system, the first would obviously, there are a lot of clinics and hospitals still using a local EHR, so you have to move to a cloud-based EHR system, and cloud systems are more flexible and they are a little bit more cheaper to maintain. And you have to make sure that your EHR has HL7 FHIR capabilities. You have to make sure that you have HL7 FHIR APIs that allow different systems to interconnect. Then we also have to have implement a modular architecture, so that each module can be maintained separately, and it's easier to find out a bug and resolve that. And obviously we have to focus on compliance, so we have to make sure that we are following all the ONC certification guidelines, we are following all the HIPAA guidelines, and the next step is obviously that AI is coming and we have to integrate that. So moving forward, what are the best practices as we spoke about? So obviously we have to use interface engines, Mirth and Rhapsody, that allows us to write these HL7 version 2 messages or FHIR server messages and all of that. Then we have to standardize our data. So that's another important thing, is we have a particular standard of data that we are working with on integration of all the different devices, and we have to build secure API driven connectors to ensure that, and we have to set up monitoring and auditing to make sure that these data exchanges are compliant. Now a couple of case studies on what as an organization and personally what I have worked on different HL7 integration successes. So I showed you one very small example of how a lab integration works out, but if you want to look at a general level, you can also come to capminds.com and you can see the case studies there, but this is just a sample of one case study that we work with. I believe this was last year when we worked with a ambulatory clinic. They had multi-site setup, and they were operated and disconnected with EHR, so there was a lot of staff required to move information, and we don't know how secure the data is. Obviously they go through the HIPAA training and everything. So when they partnered with us, they wanted us to develop a standard integration framework, and what we essentially help them is we help them to unify the patient and billing data across all systems, and we automated their reporting system. So they wanted a centralized dashboard where they can see an overview of all the patients which are coming to different sites, and they can view what is their billing looks like, what is their AR reports and all of that. And within 6 months their claim denials dropped by 18% and their scheduling improved by 25%. And with this, it is not only about helping the clinics. Essentially our end goal is obviously to increase the time a provider has so that they can see more patients and they can focus more on patient care rather than setting up EHRs, writing their op notes and all of that. Now another case study that we wanted to look at is how their network how we transferred the network for a hospital using FHIR API. And this was also, I think this was very recent. I personally didn't work on this particular project, but I know what the team worked on, what their solution looks like. So the challenge they were having is that they struggle with the disconnected lab, imaging and billing systems. So as I mentioned, there are different companies providing different data and different services. So what essentially FHIR API, when they reached out to us, is we standardized all of that, and with a singular system they were able to connect all of these different companies, and they were obviously able to standardize their data, and they were able to work with that. Another thing, what does the future looks like, and we right now we are moving to, I'll have another session probably on what artificial intelligence in healthcare looks like, but the future of healthcare interoperability is also connected to AI. With the use of AI, the providers will be able to take quicker appointments, they will be able to do quicker op notes and all of that. They don't have to put a separate day for only doing their op note. AI allows them to structure their unorganized data in a very simple structured manner, and with the implement of TEFCA, it will allow the data and flow to be seamless between healthcare providers. And obviously there are healthcare information exchanges coming up as we speak. I believe soon enough there is going to be a federal recommended HIE where every EHR will have to post their data. We already see that with the FQHCs where they have to do a UDS reporting. So I believe there will be a nationwide UDS reporting, and everybody will have to use HL7 FHIR standards to report their data, and so that the patient data can be seamless. And whenever a patient is moving states, or a patient is moving from one clinic to another, the patient data or the CCD that we talk about remains same across all the standards that we talk about. So thank you so much. This was my presentation. If you want to reach out to me personally, I'll drop my email as well, but if you want to reach out to our help system, and if you have any question, it doesn't have to be about using our services. Any questions you have, you can email help@capminds.com, and if you want to see our website, it's capminds.com, so you guys can take a look at that. Thank you so much.